excellence, journey of knowledge sharing, and journey of inspiration, which has now achieved 734th milestone of its achievements. Thank you. Thank you very much for joining and blessing us as a speaker, as moderator, as co-host, everything. I would like to welcome our guardian, Professor V.K. Agnihotri, ex-head of the Department of Swasthya, Haridwar Ayurvedic College, Uttarakhand Ayurvedic University. I welcome Dr. Raji, our today's speaker. I welcome Dr. Nishant Shuklaji and Dr. Aparna Surendraji, along with respected Jagdishwarji, Nitinji. Thank you. Thank you very much for joining. Without wasting much time, I would like to invite Professor V.K. Agnihotri, sir, for his welcome address.
Namaskar. Thank you, Professor Pawan Sharma ji. It's a great pleasure that we again joined our webinar on numbering 734, and that too on topic hypertension, the AYUSH remedies. First of all, we like to welcome our guest speakers, very distinguished guest speakers, and especially Dr. Mohammad Razi Ahmed, who is joining for the first time. He is the assistant professor, Department of Modal Health, that is known as Medicine, Government CP College and Hospital, Patna. And our next speaker of today's evening is Dr. Nishant Shuklaji. He is a very renowned person of Chikitsa. He is professor at Department of Chikitsa, Shri V.M. Mehta Ayurvedic College. He has also been former head of Chikitsa, Shri Gulaba Banwa Ayurvedic College, Anantnag. At the same time, our next guest speaker will be Dr. Aparna Surendra, and she is yoga and naturopathy physician, Satyasri Yoga and Naturopathy Clinic there in Mysore. So today we are going to know a lot of new things regarding the hypertension. As we all know, tension itself health hazard, and when it becomes hyper, it is known as hypertension. And hypertension with a special reference to the human body. Now we can't say that any gender or any age is free from this symptom or problem, though it's a symptom which is predisposed and information for the disease. So it may be involving our cerebral system, our brain stuff, our cardiac system, our heart, and our kidneys. Apart from that, obesity, thyroid, and other things are also having etiological factors for this. So this hypertension, we are going to know more and more ways and means by the different disciplines of AYUSH. So with these initial words, I welcome all our distinguished speakers along with our platform dignitaries like Dr. Jagdish Domaji, our Dr. Nitin Purmaliaji, and those who will join later on, and also those who will visit our YouTube and our archives also. So with these words, I hand over for the further proceedings to Professor Pawan Sharma. Thank you.
Thank you. Thank you very much, sir. After victimization of Zoom bombarding, we are not inviting more candidates on Zoom directly. We are leaving it to our respected speakers, those they want to call. And this will be live on YouTube. We will be circulating you YouTube's link, which can be circulated everywhere. So this journey is really beneficial for Ayurvedic doctors, students, and Ayurvedic lovers. We are continuing this journey up to 734th miles. That means your cooperation, your mentorship is excellent. We are grateful for that. So without wasting much time, I would like to invite our first speaker of the day, Dr. Raji. Welcome, Dr. Raji, Mohammad Raji. Welcome. Please unmute yourself.
Thank you, sir, for all of you, all the senior faculties member there joining. I am the one of the most juniorest one because I am the I have only 4 years of experience in this teaching at our academic field. I have completed my post graduation in 2012, but that's on that to the till 2019 only. I practice as a practice, especially in the cardiodialysis. But after in February 2019, I was joined Government Tibbi College and Hospital Patna as assistant professor. Till that day, I am involving with the academic also as well as private practicing. So first of all, thank you all of you for inviting me to such a nice cause to educate the people along the IUs and all over the population. So first of all, in the I'm saying sorry to all of you. Yes, suddenly I was received a call from Pavanji and the inspection going on in my institute. So complete presentation was not prepared, but I have trying my best to prepare presentation. So first I will share my presentation. Then, sorry. Basics. Wait a minute, sir. I will share.
No problem. Please take your own time. Yes, your screen is visible. You can go for slideshow.
It's visible right now, but it is not showing on full screen actually.
No problem. No problem. You can start.
Can showing source?
हाँ ये PowerPoint मोड में चालू है अभी. आपके यहाँ नेट कमजोर है, आप अपना वीडियो बंद कर लीजिए. हाँ, इट इज विजिबल. आप अपना वीडियो बंद कर लेंगे तो आवाज क्लियर आएगी.
ओके सर.
थोड़ा देखिए.
हाँ ठीक है, थोड़ा इसको फुल साइज में कर दिए, नीचे 3 बटन दबा के.
वीडियो
हाँ, इट्स विजिबल.
हेलो.
हाँ, इट्स विजिबल. ठीक है, प्लीज कैरी ऑन.
Okay. So first of all, I would like to present the hypertension Unani concept. In the Unani system of medicine, hypertension is known as the Zaktuddam Kavi. Zaktuddam Kavi, the concept, exactly what Zaktuddam Kavi is not mentioned in the ancient Unani text or classical Unani text, but there is the many research is going on, and also past it was done, and on the basis of their clinical scenario, it is found the very resemblance to the hypertension and the Zaktuddam Kavi. So first of all, I will go to the history of hypertension. So history what says that around 2600 BC, hard pulse disease. Hypertension is also known as hard pulse disease. Hard pulse disease in the sense when there is the pulse condition is hypervolemic.
आपकी फर्स्ट स्लाइड विजिबल है, सेकंड नहीं दिख रही है. हाँ, रीशेयर एक बार शेयर कीजिए. प्लीज शेयर इट अगेन. यस, आई होप नाउ प्रॉब्लम विल बी सॉल्व्ड. Go for slideshow from down. Yes.
On full slide.
स्लाइड शो नहीं हो रहा है. स्लाइड शो आपका कोई बात नहीं, इस पे डायरेक्ट साइड वाली स्लाइड्स पे क्लिक करते जाइएगा, स्लाइड चेंज होती जाएगी. 2 नंबर पे क्लिक कर दीजिए.
Which number?
2 नंबर स्लाइड पे क्लिक कर दीजिए. 2 नंबर 2.
On second slide.
You can click on second slide. No, still it is first.
It is okay. Have you seen? Hello. Anyone can unmute yourself and
Yeah. You please click on your PPT. This is the full detail of the screenshot.
it is moving.
Select. No, not moving. Select
अभी
your
आपकी
PPT.
केवल स्क्रीन दिखाई दे रही है पूरी की पूरी.
Yes, you are selecting hypertension 01. Yes. Now double click.
Yes, I have clicked the double. Then which one slide is shown? Yeah. Why this type of things
आप
happen?
मुझे व्हाट्सएप पे भेज देंगे, मैं शेयर कर सकता हूँ.
Okay, मैं सेंड कर रहा हूँ सर.
It's a bit long. 249.
Okay, मैं शेयर कर रहा हूँ सर आपको व्हाट्सएप पे.
और तब तक आप चालू रखिए एक्सटेम्पो मतलब स्लाइड से. मैं इन द मीन टाइम स्लाइड शेयर कर दूंगा.
तो
मैं आदरणीय डॉक्टर महेश शर्मा जी का स्वागत करता हूं। आपने भेजा मुझे?
Yes, I have sent.
नमस्ते डॉक्टर साहब।
नमस्कार नमस्कार साहब।
चल बंद कर दे।
जी आप तब तक चालू कीजिए।
Okay. Now I will start it. So I was started talking. Zaktuddam Kavi. Zaktuddam Kavi is the mentor. So first of all, we will see the historical background of hypertension. So first thing, as a hypertension is not mentioned in the BC. So first time 2600 BC or its back, hypertension is known as the hard pulse disease. Means there is the high volume pulse or there is the hardness in the artery. You can resemblance with the it is atherosclerosis or stiffness of the arteries also. So first time before the 2600 BC, it is hypertension is known as the hard pulse disease. Then second time, secondly, in short, I am going to this in short, 120 AD, cupping therapy, one of the therapy, regimenal therapy, types of regimenal therapy, which is in our system of medicine, means Unani system of medicine, or the Chinese system of medicine, cupping therapy. So cupping, while it shows cupping therapy is the on animal that hard pulse disease were found to be reduced hardness or the volume. That's why it is known as the volume is increased or hardness on increase. For Unani physicians regarded Zakte inkebazi as systole and Zakte imbesati as diastole. Ibnul Nafis, the ancient Unani scholar, in 1208 to 1289, his lifespan was described the organ of circulation. That is, we all know in current era, the organ of circulation, which is arise from the heart, and it goes all part of the body. So, but till the 17th century, there is no way to measure. Till the 17th century, there is no way to measure blood pressure. After that, before this 17th century, ancient physicians, or you can say Unani physicians, could estimate by the feeling of pulse and resemblance to the blood pressure, or in a Unani term, Zaktuddam Kavi. So by the feeling of pulse, through the volume, through the character, and through the artery status, they can be correlated with there is the increased pressure in the arteries. On 1733, Reverend Stephen Hales intra-arterial pressure measured intra-arterial pressure in the horse. Then 1905, N.C. Krotokoff. The name N.C. Krotokoff was reported the auscultation of the brachial artery method to use. That is currently used the Krotokoff method to measure the blood pressure. As we know the different phase of sound which is found in the while we measure the blood pressure through the auscultatory method, so called Krotokoff sound or Krotokoff phase of sound. So it provides not only the systolic blood pressure, but it also provides the diastolic blood pressure. So this is the basic history of hypertension, or you can say blood pressure. how from the 2600 BC to the 19th century, it was developed, and we are using the para or dial or digital method of measurement of blood pressure. Then come to the Unani concept of hypertension. According to Zakaria Kazvini, Zakaria Kazvini, the arteries right from the left ventricle, which is also known as the arch of aorta, so infuse pure air in the entire body. Means while the oxygenated blood comes in the left side of the heart and it goes in the systemic circulation, it provides entire body and return from the right side of the heart through vein. When blood pressure is more than normal, it is considered as a high blood pressure or hypertension. In the time of Zakaria Kazvini, the Zakaria Kazvini was the ancient Unani scholar or Unani physician. In 400, around after the Hippocrates, the organ circulate have been described as Ibnul Nafis. The function of the heart described by the Aristotle has been completely negotiated by Ibn Nafis and Damsiki. In all, Maliki and Al-Abbas has mentioned the basis of health. Basis of health is right per person and a specific equilibrium on the basis of akhlaq. Akhlaq, it is the humors. Our Unani system of medicine, there is the 4 type of humor. You all know, you all are the senior faculty. So we call this dam, balgam, safra, soda. Dam is the rakt or blood. Balgam is the phlegm or cough. Safra is the yellow bile and soda is the black bile. These 4 things which will be included in our blood, and it maintain the homeostasis of internal environment. So on that basis, if there is any abnormality in these humors, either it is in the quantity or it is the quality. If there is the quality changes, so it disturbs the homeostasis. If it is the quantity changes, it disturbs the function of the organs. So these humors maintain the homeostasis so in balanced form. If we can see the types of hypertension according to modern system of medicine, there is basically 2 types of hypertension, hypertension stage 1 and stage 2. And there is the many more classification according to blood pressure, according to situation, like orthostatic hypertension, isolated systolic hypertension, accelerated hypertension, hypertensive urgency, hypertensive emergency, malignant hypertension, refractory hypertension, etc., etc. But basically, there is the 2 types of hypertension, either stage 1 hypertension or stage 2 hypertension. And also one thing is classified as a hypertension, primary hypertension or secondary hypertension. The primary hypertension, you can say there is the only risk factor, there is no defined or definite cause. The secondary hypertension, which is the defined or definite cause. In Unani system of medicine, also it is classified as 2 types, al-imtila, bisabil, avaya, or al-imtala, bisabil, kuwa. Bisabil avaya or bisabil and bisabil kuwa is basically the kuwa is the power and avaya is the response of body. So there is the 2 type of 2 type of hypertension, that is al-imtala bisbail or bisbail avaya or al-imtala bisbail kuwa. Then in modern, according to the base of according to the base of so cause of as we know there is the there is the cause of hypertension is only secondary hypertension causes. The primary hypertension, there is no definite or classified cause. So there is only the things which is risk factor. So there is many books and are written. So I will not going to discuss all the causes of secondary hypertension and all the causes of risk factor of primary hypertension. But there is the further classification of secondary hypertension, which is on the base of organ involvement in the body. So total 5 to 10% of cases belongs to the secondary hypertension. In that 5 to 10% cases, about 4 to 6% cases found renal hypertension, 1% portal hypertension, 1%, 1 to 2% pulmonary hypertension, and 1 to 2% other cause of hypertension, like any hypertension occur due to any medicine like NSAID or cocaine or contraceptive pills.
Dr. Mohammad Razi ji, excuse me.
Right. Yes, sir.
What I want to convey is that since we have got 2 webinars on today, and the second one will be starting by 9:30, so we have got 3 speakers, including you. So if we manage the time before 9:30, so almost the next 12 minutes are with you.
Do it. I will definitely do it, sir.
Okay. Next 12 minutes are with you. So we would like to have much more importance of treatment from your Unani side.
Okay.
Rest you have to decide that which of the portion
Just
you can
skip. I will go
yes.
through the slide.
Thank you. Yes. Thank you so
much. I'm directly going to the Unani cause of hypertension. As we have already discussed, there is the abnormality found in the quality or quantity of hypertension. So if there is the quality of hypertension is normal, then it is called al-Intl bisabil. Quality, if there is the quality normal but quantity is improved, you can say there is the cardiac output is increased. That's why it is called hypertension. And it is very resemblance as we have seen in the modern parameter. It causes whenever there is the found of hypertension, there is the epilepsy or apoplexy and other hemorrhagic condition. Then come to the next is Intl bisabil. Intl bisabil ilbasul kuwa means power. If there is the abnormality in the quality, not the quantity, there is the quantity is normal, means cardiac output is normal, the volume is normal, but there is the response of vasomotor response, or you can say vessels response is poor, or any abnormality, or if there is the humus quality is abnormal, like sue misaj, then it is called Intl bisabil kuwa. These are the risk factors. If we are seen in the pathophysiology or pathogenesis, there is the basically 2 mechanisms. I'm not going to their detail. Basically, there is the 2 mechanisms: short-term regulation of blood pressure according to the modern medical science, short-term regulation and long-term regulation. Short-term regulation mainly depended on the basis of neuroregulation, and long-term regulation on the basis of renin, angiotensin, aldosterone system, that is also known as RAS. So we all know about these phenomena, how it the molecular level act. So I'm not going to discuss all these things. I'm going to discuss about the Unani pathophysiology. Unani pathophysiology, a disturbance in the hemostatic condition. Hemostatic static condition of the internal environment, it causes sue misage of the entire body. Sue misage, you can say every person or every disease have a particular misage or temperament. Misage also known as in the English temperament. So if any person have that any disease, itself person have the temperament, and the disease also have the temperament. If any disease is belongs to the acute condition, if any disease belongs to the acute condition, that is most probably chances there is the two humus abnormality, that is either yellow bile, that is safra, or either dam or rakt or blood. If there is any chronic condition which is less symptomatic, so this is found mainly two abnormality in the two humus, which is phlegm, bulgum, and soda, that is yellow bile. If
Now,
there
are
is
you moving the slides? Are you moving the slide or not?
Yes, I am moving the slide.
I am moving, sir. I am moving.
Okay, okay, but the on screen the first slide is still displaying.
No, no, no.
Yes, yes.
So if we are going through these concept, the acute disease belongs from the blood or yellow bile, and chronic disease from the phlegm or black bile. We see there is the compound temperament. There is the compound temperament of these humus individual. Like if we can see the blood temperament, it is hot and liquid. If we see the yellow bile, it is hot and dry. Then we have seen in the just opposite. If we see in the phlegm temperament, we have seen there is the phlegm temperament have cold and liquid, but there is the black bile, it is cold and dry. So if there is the hypertension, especially the primary hypertension, there is mostly chances of the temperament sue misage of the temperament abnormality in phlegm, means bulgum, because most of the things which was happen in the sue misage through the phlegm abnormality, it is directly proportional to the increased lipid level, increased body weight, and it lead to the increased blood pressure. So, and if we see there is the acute hypertension due to any cause like head injury or acute renal injury or the acute any medication. So we have seen there is the cause behind the human misage is blood that is hot and liquid form. So in these conditions, there is the hypervolumic. If we see in the acute form of accelerated hypertension or hypertensive urgency or hypertensive emergency. If we see the primary hypertension or essential hypertension, we have seen there is the obesity, there is the atherosclerosis, there is the other risk factor, there is the age, all these things we have found. So if we have found there is the Zaktuddam Kavi, actually the Zaktuddam Kavi is the broad term. Kavi called power, and Zaktuddam means pressure of the blood. Dam means blood. So if there is the found power increase in the blood, power increase on the blood flow pressure, it is called Zaktuddam Kavi. But ancient time, there is no term which is found in any classical Unani literature or any Unani scholar mentioned in any of their books. Zaktuddam Kavi. They mention as Intl. Intl, it is also a broad term where this is found the congestion of the vessels, or excess load or hyper volume in the vessels. So these Intl cause many type of complication, and if we see there is the clinical feature in the modern parameter like headache, morning stiffness, and vertigo, and other complication like stroke and MI or coronary artery disease, atherosclerosis. All these features were found in the Intl. Either it is Intl bahasbul awaya or Intl bahasbul kawa, kawa ya kavi. Then now we have to move from the management part. In Unani system of medicine, there is as other system of medicine, there is the 4 method of mode of treatment. That is, first thing is the therapy. Which is directly belongs
आपकी आवाज बंद हो गई है जी।
especially means non-communicable
थोड़ा फास्ट करेंगे तो अच्छा है, प्लीज फास्ट। आपकी आवाज बंद है।
आवाज नहीं आ रही है तौहीद साहब, आवाज नहीं आ रही आपकी।
just a minute, sorry, it was hello।
हाँ जी, हेलो।
Okay, so इलाज बिल दवा means the pharmacological management. If there is the need of, if the disease is not controlled by the, lifestyle modification or dietotherapy, then we will go with the pharmacological management. And if it is also insufficient, then we will go to the regimental therapy. There is the many regime. In that many regime, few of the regime which is very useful in the case of hypertension. I have to discuss management part about remaining to Unani concept, modern concept. I was included in this slide, so I will orally tell the Unani part of management. So first of all, I will be discussed in brief. Yes, sir. First of all, I will be discussed on the basis of ilaj bil ghiza, means dietotherapy. Dietotherapy include especially if we have seen weight reduction, how we can manage the weight. If we have seen the how we can manage the weight in Unani system of medicine, there is the 3 things. One is the physical modification. Then second is the diet. Physical modification means there is the exercise or the addiction if they have. So to rule out to omit or reduce the addiction, then we can proceed on the dietotherapy. Dietotherapy, especially we are focusing on the DASH diet. In the dietotherapy, we are focusing on the DASH diet. That is also known as dietary approach to stop hypertension. DASH diet include the mainly the unprocessed food. Dash diet including the unprocessed food, like if we are using in चना, मूंग, ऐसी चीजें जो होती हैं, we are providing these, and salad. Our target, we can increase the protein form of diet but reduce the carb form of diet. Also, we have to reduce diet white sugar. We can use the brown sugar, we can give the honey, but we have to reduce or stop white sugar. And this is also very resemblance according to the modern science. So DASH diet include stop the dairy product, stop the low sodium diet or dietary sodium.
कुछ मेडिसिन बता दीजिए अपनी यूनानी सिस्टम की.
Okay,
इफेक्टिव मेडिसिन में हम दूसरे का टाइम नहीं दे पाएंगे ना.
I will go to the one of the patented medicine, that is Asrol. That is Asrol. Asrol was firstly used in Hakim Ajmal Khan. Hakim Ajmal Khan is the father of Unani system of medicine in India. That's why we are celebrating Unani Day on his birthday. They have clearly described about the Asrol. It dilate it is act as a venodilator, act as a arteriodilator, act as a diuretic. So it provides multiple benefits, like stop the vascular remodeling, reduce the atherosclerosis, then come to the reduce the and improve the kidney function. Then come to the next drug. There is the many other drug. I will discuss especially those things, the compound Unani formulation. Safufe Muhazzil. Safufe Muhazzil have the basically 7 drugs, including lac and other the main ingredient was the lac. It has the power of anti-lipid and vasodilator effect. It has the anti-lipid and vasodilator effect. So we are using as a compound formulation Safuf. Safuf means powder form of Muhazzil, or it is Majun means halwa, or linctus form of Muhazzil. These Muhazzil medicine cause weight reduction, reduce blood pressure, and increase the good cholesterol, HDL. There is the more than 100 of researches has done. It increase HDL level. So prevent the coronary artery disease as well as stroke. If we are discussing about the
Time completed.
Sir, I think time is over, and you are mentioning the 7 ingredients item. So it might be containing sugar. So I don't think it's safe for the diabetic patient. Diabetes are also having
that's why I have told. That's why I have told.
Sir, we will take as a question answer at the last of our. Our second speakers are waiting,
okay,
and we are taking their time, sir.
You can ask the question.
Please conclude.
Okay, so the next thing is the regimenal therapy. We are providing basically 4 regimes to manage hypertension. One is the cupping therapy, when we especially weight cupping therapy, which is blood letting therapy. Second is the leech therapy, when there is the viscosity of blood will high, so as a blood thinner. And third regime is the hammam, especially you can say steam bath. So all these methods we can manage the blood pressure and reduce the body weight, reduce and detoxify the body and control the blood pressure.
Thank you, sir.
So I have to conclude here because of lack of time. So if anyone have any question, you can ask.
Thank you, sir.
Thank you. Thank you very much. Now I would like to invite Professor Nishant Shukla ji from Anandpur. Welcome. Welcome, Nishant ji.
With a time limit of 15 minutes.
नमस्कार सर.
Namaskar.
Sure. नमस्कार. कुछ भी प्रियम्बल से पहले आज मैं थोड़ा जो है अलग बात करूंगा. आज इसके बाद मुझे पवन जी जो है वो काफी डांटने वाले हैं, क्योंकि विषयांतर आज भी थोड़ा जो है मैं करने वाला हूं और सभा से अनुमति लेकर के ही विषयांतर पर मैं जो है ये जा रहा हूं. हम बात करते हैं ट्रीटमेंट की, और ट्रीटमेंट के लिए बेसिकली खुद की जो है एक फिजियोलॉजी की अंडरस्टैंडिंग भी जरूरी है. आयुर्वेद में जो कुछ भी डिस्क्रिप्शन है ये ऑर्गेनिक पैथोलॉजी की जगह पर फंक्शनल पैथोलॉजी या फिर जिसे दोषिक पैथोलॉजी को मान करके हम ट्रीटमेंट करते हैं. पर हाइपरटेंशन की जब हम बात करते हैं तो हमारी मर्यादा ये है कि स्फिग्मोमेनोमीटर के इन्वेंशन के बाद ही इसका जो है वो हमें मालूम पड़ा है. पर ये फिनोमिना बॉडी में है. ह्यूमन बॉडी इज मोर देन 1 लाख ईयर्स. तो ये फिनोमिना तो बॉडी में है. ओनली हमें इसके बारे में जो है ये मालूम पड़ा है ये पिछले कुछ 200 सालों के पीरियड में ही मालूम पड़ा है. पर जब हम ट्रीटमेंट देते हैं, आयुर्वेद की ट्रीटमेंट देते हैं, तो हमें किन किन बातों पर खास फोकस करना रहेगा, और आयुर्वेद में हम इसकी फिजियोलॉजी को किस प्रकार से स्टडी करेंगे, ये आज जो है ये ज्यादा जरूरी है. आज मुझसे पहले जो वक्ता थे उन्होंने काफी सारी बातें अवेयरनेस के बारे में की है. आज मैं थोड़ा जो है वो हट करके इस बारे में थोड़ी चर्चा करने के लिए जा रहा हूँ. ये कुछ बीज जो है ये बोना चाहता हूँ. अगले सालों में हम इसके कुछ फल हमारे पास हों, इस प्रकार से अपनी मैं प्रस्तुति करने जा रहा हूँ. मैं अपनी स्लाइड शेयर कर लेता हूँ. जस्ट अ मिनट. Need for Ayurved's understanding about hypertension, blood pressure term and values after invention of sphygmomanometer. This is after the invention of sphygmomanometer. उस समय तक हमारी जो भी अंडरस्टैंडिंग थी, that was on the basis of the pulse. पल्स के प्रेशर को हम जानते थे, पल्स की रेट, रिदम, फोर्स, वॉल्यूम, प्रेशर, इसको जो है हम जानते थे. पर इसकी जो है वो फिगर आउट रैशनल डिस्क्रिप्शन या फिर अनबायस्ड ऑब्जर्वेशन हमारे पास जो है वो केवल स्फिग्मोमेनोमीटर के इन्वेंशन के बाद ही जो है ये मिली है. तो हमें इस चीज को ध्यान में रखना पड़ेगा, और इस प्रकार से हमें भी ऐसी चीजें इंस्ट्रूमेंट्स को डेवलप करने पड़ेंगे कि जो हमारी फिजियोलॉजी को समझने में हमें मदद करते हैं. नो सिनोनिम फॉर ब्लड प्रेशर इन एंशिएंट आयुर्वेदिक टेक्स्ट. जब हम 1-to-1 कोरिलेशन की बात करते हैं तो स्पेसिफिक वर्ड को ढूंढना ये जो है ये हमें नहीं मिलता है. देयर आर द डिफरेंट मैकेनिज्म्स एंड डिफरेंट टर्म्स गिवन बाय द स्कॉलर्स of the 20th century, and they have worked a lot for treatment of hypertension. Ayurveda describes the rasa as the circulating fluid, the nutritive fluid. Here is the difference of the approach between the modern and the Ayurveda counterpart. जब हम बात करते हैं सर्कुलेशन की या फिर सप्लीमेंट ऑफ द न्यूट्रिशन की, तो आयुर्वेद में जो शब्द यूज हुआ है वो रसानुधावन है. और रस जो है ये न्यूट्रिटिव फ्लूइड, ये सर्कुलेट होता है. ब्लड कॉर्पसल्स जो है दे आर द पार्ट एंड द पार्सल ऑफ द प्लाज्मा और द सीरम. कॉम्प्लिकेशन ऑफ ब्लड प्रेशर अकर्स, दे कैन बी कोरिलेटेड विथ द रक्त दुष्टि. जिस प्रकार से ज्वर में और त्वक रोग में, कुष्ठ में जिस प्रकार से धात्वंतर गति की बात है, धातुओं की दुष्टि की बात है, रस से रक्त की दुष्टि, उसके बाद मांस की, उसके बाद मेद की दुष्टि की जहां पर बात है, उसी प्रकार से जो हाइपरटेंशन के कॉम्प्लिकेशन और खास करके सेरेब्रोवास्कुलर एक्सीडेंट्स, दे आर ड्यू टू द इन्वॉल्वमेंट ऑफ द रक्त। तो ये कहीं ना कहीं जो है ये इसके साथ जो है ये संबंध बैठता है। वी नीड टू अंडरस्टैंड एंड क्वांटिफाई एंड एविडेंस फॉर द फंक्शंस ऑफ व्यान वायु, अवलंबक कफ, साधक पित्त, रस, शिरा। Physiology of blood pressure ought to be worked up with the description of these body humors. Now, what are the knowledge and the research gaps in Ayurveda? We know the modern description. What are the factors that plays the role? The function of the heart, the status of the arterial wall, the composition of plasma. ये जो है ये तीन main factor हैं. Last one is the cerebral factor जो controlling central controlling factor है. ये regulate blood pressure को करते हैं. तो हमें भी उस प्रकार से आयुर्वेद में इसको जो है वो डिस्क्राइब करने की जरूरत जो है ये है. So we lack in the understanding in the physiology of blood pressure. We are treating blood pressure. We are not only treating, we are effectively treating the blood pressure. One. Second, we are effectively improving the quality of life with the use of the Ayurvedic medicaments and procedures. शिरोधारा है, मूर्ध तेल है, उससे जो है वो पेशेंट को रिलीफ मिलती है. सर्पगंधा को यूज करने पर टारगेट ऑर्गन डैमेज जो है ये कम होता है. इस पे ब्रेडिकार्डिया ये इंड्यूस करता है. आज हम ब्रेडिकार्डिया से डरते हैं, पर एक फिजियोलॉजिकल वर्क हुआ है जहां पर ये ऑब्जर्व किया गया कि अगर ब्रेडिकार्डिया इंपोज किया जाता है हाइपरटेंसिव पेशेंट में तो कार्डियक डैमेज और टारगेट ऑर्गन डैमेज, किडनी का डैमेज, वास्कुलर डैमेज, उसको जो है वो कम किया जा सकता है. फिब्रिलेशन चेंजेस को कम किया जा सकता है और डिले किया जा सकता है. सो हम ये इफेक्टिवली कर रहे हैं, पर जब हमारी क्रिया शारीर की बात होती है या फिर दोष धातु मल के हिसाब से हमें डिस्क्रिप्शन की बात आती है तो हम वहां पर लैक कर रहे हैं. आयुर्वेदिक अंडरस्टैंडिंग टू अंडरस्टैंड द पैथोलॉजिक प्रोसेस इज अनक्लियर और need to be worked up. We need a more work to be done for using the different medicaments. We need the different approaches. What we need to do it. आज जिस प्रकार से मेनली जो है वो 4 कैटेगरीज में मेडिसिन है, कैल्शियम चैनल ब्लॉकर है, अल्फा ब्लॉकर है, बीटा ब्लॉकर है, सी ब्लॉकर है, या फिर और कोई नया जो है ये आएगा, एल्डोस्टेरॉन का रोल है. तो हमें अपने हिसाब से भी उसको जो है वो अंडरस्टैंड करने की जरूरत है और उस प्रकार से हमें सिलेक्शन ऑफ द मेडिसिन ऑन द बेसिस ऑफ द इंडिविजुअलिटी को भी हमें वर्क अप करने की जरूरत है. द पैथोलॉजिकल चेंजेस इन प्रकृति, पैथोलॉजिकल चेंज इज प्रकृति सम संवेद वेराइटी और विकृति विषम संवेद वेराइटी. दिस इज नॉट क्लियर. वी नीड टू focus on this one because whatever the treatment we will give, we need to disintegrate the amalgamation of the doshas and dushas. तो दोष और दोष के amalgamation या फिर समूर्छना है, ये प्रकृति सम संवेद वैरायटी से है या विकृति विषम संवेद वैरायटी से हो रही है. तो उनको जो है वो हमें समझ करके उनकी ट्रीटमेंट ये करनी पड़ेगी. जब हम एसेंशियल हाइपरटेंशन की बात करते हैं तो उसमें थोड़ा बहुत जो है ये रोल वायु का है और शिरा का है. इसके अलावा कोई रोल जो है वो क्लियर नहीं हो रहा है, पर उसके लिए डिटेल स्टडी की हमें जरूरत है और आयुर्वेद के फंडामेंटल्स के साथ उनको करनी पड़ेगी. नाउ धमनी और शिरा, ये बेसिकली हम आर्टेरियल ब्लड प्रेशर की बात करते हैं और सुश्रुत ने धमनी को शिरा विकार के रूप में लिया गया है. गाणेकर जी ने इस पर जो है वो काफी सारा काम किया है और ये अप्रोच जो है ये ठीक है कि भाई धमनी को और आर्टरीज को धमनी कहें, वेन्स को शिरा कहें, पर जब आयुर्वेद में बात आती है तो ये टर्म्स जो है वो इंटरचेंजेस जो है वो काफी जगह पर जो है वो होते हुए दिखे गए हैं. अवैद्य शिराएं जो है ये कहीं ना कहीं इनका डिस्क्रिप्शन धमनी के साथ भी जो है आज अंडरस्टैंडिंग में हमें जो है वो दिख रहा है. तो हमें उपधातुओं की क्रियाओं पर भी काम करने की जरूरत पड़ेगी और उसके अनुरूप हमारी जो है वो फिजियोलॉजी और पैथोलॉजी की डिजाइन जो है ये होगी। किस प्रकार से हम सोच सकते हैं, उसके लिए मैंने कुछ जो है वो यहाँ पर विचार रखे हैं। मैं विद्वद्गण से उनको अनुमोदित करना या फिर उन पर टीका टिप्पण जो है मैं चाहूंगा। पैथोलॉजी इज डिविएशन फ्रॉम द फिजियोलॉजी। दिस इज माय बेसिक आइडिया ऑफ today's presentation. Now coming on to the first important role of the circulation, it is related with the movement of the giving the nourishment. बेसिक फिजियोलॉजी में हम जब बात करते हैं, बेसिक बायोलॉजी में जब हम बात करते हैं, तो न्यूट्रिशन, सप्लीमेंटेशन ऑफ द न्यूट्रिशन एंड सप्लीमेंटेशन ऑफ द ऑक्सीजन रेस्पिरेशन, ये दो जो है ये किस प्रकार से डेवलप हुआ, ये एक क्रमिक प्रक्रिया है। यूनिसेल्युलर ऑर्गेनिज्म में एक प्रकार से थी, टू सेल्युलर, मल्टी सेल्युलर और फिर कॉम्प्लेक्स एनिमल्स में, ममेल्स में ये जो है वो पूरा जो है वो अलग होकर के आया। और ममेलियन एनाटॉमी और फिजियोलॉजी जब हम देखते हैं तब वहां पर जो है वो हार्ट, लंग्स और सर्कुलेटरी सिस्टम वेल डेवलप जो हम ह्यूमंस में देखते हैं उस प्रकार की है। तो आयुर्वेद इसके लिए जो है वो रस को प्रधान जो है ये धातु मानता है कि जो शरीर में नरिशमेंट देती है। स हृदय चतुर्विद विंशति दमनी अनुप्रविश्य ऊर्ध्व गदश अधोगदश तीर्यकश्च तीर्यगा कृष्णं शरीरम अहरम हर तर्पयति वर्धयति धारयति यापयति च अदृष्ट हेतु के न। इसका वो कौन सा हेतु है जिसके कारण ये इम्पल्स क्रिएट होते हैं। उदान वायु में जो प्रयत्न का जो गुण बताया, जो प्रयत्न का कर्म बताया है, तो दिस इज द जेनेसिस ऑफ द इलेक्ट्रिकल इम्पल्स जो कंडक्ट होता है एवी नोड पर, जो कंडक्ट होता है आकर पर्किंस फाइबर्स में, और उसके बाद कंप्रेशन जो है ये होता है। एंड विथ एवरी कंप्रेशन ऑफ द मसल्स ऑफ द हार्ट द ब्लड इज रश्ड इनटू द एओर्टा एंड देन टू होल बॉडी। तो ये जो है वो पल्सेटिंग कैरेक्टरिस्टिक को सुश्रुत इस प्रकार से बताते हैं, तस्य शरीरस्य अनुसरतो अनुमानात् गति रूपम रूपलक्षितव्या क्षय वृद्धि वैकृतैः स शब्दार्चल जल संतानवत अणुना विशेषेण अनुधावति एवं शरीरम केवलम। तो ये पूरा जो है वो पल्सेटिंग कैरेक्टरिस्टिक वन बाउट आफ्टर द अदर, this is the complete cycle of the heart, and after every completion of the cycle of the heart get paused for 50% of the time, and then once again it starts into the action, and this goes on. Now when we are dealing when we are discussing about this one, the concept of OJ is needs to be discussed. हम ओज को जो है वो उपधातु के रूप में मानते हैं, सप्त धातु के समन्वय के रूप में, परम तेज के रूप में मानते हैं। ओज का निर्माण शुक्र शोणित के साथ जब गर्भ की निर्माण होता है उस समय भी होता है। तो ओज को काफी सारे अलग अलग अर्थों में समझा गया है। यहाँ पर ओज की विशेष करके मैं ये बात यहाँ पर रखना चाहूंगा। परस्य श्रेष्ठ अष्टबिंदुकस्य इति अर्थः। तो ये अष्टबिंदु प्रमाण में ही ये ओज है और ये हृदय में ही स्थापित है। तो ये हृदय में जो है इसका संबंध सीधा जो है वो व्यान वायु के कर्म से है, क्योंकि जब हम उदान वायु से है, जब हम उदान वायु में कर्म को समझते हैं, सीखते हैं, तो वहां पर दो कर्म जो है वो काफी ध्यानाकर्षक है। एक प्रयत्न और दूसरा जो है ये ओज। तो ये प्रयत्न का जो है ये अर्थ कहीं ना कहीं टू कंटिन्यू द लाइवलीहुड, और the first continuation of the livelihood is to generate the necessary impulse for circulating the blood. तो ये कहीं ना कहीं ये ओज के साथ इस प्रकार से है। तो ये पर ओज का ऐसे नोट के साथ, इसकी फंक्शनलिटी के साथ ये संबंध जो है इसको देखा गया। और लास्ट में इसको एम्फसाइज करने के लिए लास्ट लाइन मृत्युर्भवति हृदय इत्यादीनां ग्रंथेन दर्शयति। अष्टबिंदु ओज की जब क्षीणता होती है, अल्प मात्रा में भी क्षीण होने पर मृत्यु को उत्पन्न करती है। तो ऐसे नोट से अगर इम्पल्स आना बंद हो जाए तो ये कार्डियक अरेस्ट को ये ट्रिगर आउट करती है। द सेम थिंग इज हाईलाइटेड। तथा परस्य ओजः स्थानम चेतन संग्रह, ये चक्रपाणी ने बताया है। तो ये हृदय की बात है, तो हृदय में भी चेतना का स्थान, तो चेतना के स्थान को हमें जो है वो कहीं ना कहीं इसके साथ हमें समझना होगा, और उसका जो है वो कोरिलेशन, इंटर रिलेशनशिप हमें उदान के कर्म के साथ हमें ये समझना होगा। आई हैव हाइलाइटेड दीज टू थिंग, चेतन संग्रह स्थानम and prayatna oja bala varnadi karma cha, these are the functions of the udan vayu. So the role of the udan vayu and next one is the pran vayu are important for generation of the impulses necessary for circulation of the rasa inside the body. These are the very popular two shlokas. Vyanena rasadhaturhi vikshepochit karmana yukpat sarvato jasra देहे विक्षिप्यते सता, या फिर कृष्ण देह चारो व्यानो रस संवहन अद्यत स्वेद अश्रुक श्रवणश्चापि पंचदा चेष्टित्यपि। तो ये स्वेद की, अश्रुक की ये क्रिया भी ये करते हैं। तो थर्मो रेगुलेशन में, ब्लड सर्कुलेशन में इनका जो है ये रोल, ये अंडरस्टैंडिंग की जरूरत मैं समझता हूं। नाउ ये कुछ एक जो है ये हाइपोथेसिस यहाँ पर मैं ये प्रेजेंट करना चाहूंगा। कुछ एक हाइपोथेसिस रंजित राय देसाई जी ने रखे थे। तो पहले दो हाइपोथेसिस उन्होंने रखे थे, वही से मैंने जो है वो लिए हैं। उनके अभिप्राय से जब पित्त और वात रक्त के साथ मिलते हैं, व्यान वायु और साधक पित्त के साथ ये होता है, या फिर व्यान वायु और पित्त के साथ ये दुष्ट होने पर ब्लड प्रेशर जो है ये एलिवेट होता है। जब वही व्यान वायु और उदान वायु कफ के साथ संबंध में आते या संसर्ग करते हैं तो वहां पर ब्लड प्रेशर रिड्यूस होता है। नाउ देयर आर द डिफरेंट कंडीशन। ये दो ही कंडीशन नहीं मिलती, हमें कॉम्प्लेक्स कंडीशंस मिलती है जहां पर शिरा में चेंजेस होते हैं, जहां पर ब्लड विस्कोसिटी में चेंजेस होते हैं। तो उनको अंडरस्टैंडिंग के लिए यहाँ पर मैंने बाकी जो है ये हाइपोथेसिस जो है ये रखे हैं। जब कफ का क्षय होता है और उसके कारण वायु की दृष्टि ये शिरा पर अभिप्रेत होती है, शिरा पर इनका इफेक्ट होता है, उसके कारण उसमें स्क्लेरोसिंग या हार्डनिंग के चेंजेस होने पर ये फिर से वायु की दृष्टि करके ब्लड प्रेशर को एलिवेट करता है। ये कॉमनली जो है ये कैल्सिफिकेशन चेंजेस में ये हम ऑब्जर्व करते हैं। नेक्स्ट वन, कफ और वात दुष्ट शिरा, जहां पर ब्लड की कंपोजिशन में चेंज होने पर, विस्कोसिटी में चेंज होने पर ये आवरण, सूक्ष्मावरण या फिर स्थूलावरण को ये उत्पन्न करता है, और सूक्ष्मावरण या स्थूलावरण के परिणाम स्वरूप ये ब्लड प्रेशर को एलिवेट करता है। यह जब धातुओं में जाता है वहां पर ये अपतर्पण के प्रक्रिया जो है ये करता है। तो वहां पर हमें टारगेट ऑर्गन डैमेज या फिर एंजियोपैथिक चेंजेस के रूप में हमें ये देखने को मिलता है, और ये क्लियरली विजिबल जो है ये आईज में ये देखने को मिलता है। फंडोस्कोपी में जब हम देखते हैं तो वहां पर ये वास्कुलर चेंजेस हमें जो है ये देखने को मिलते हैं। दिस आर एसोसिएटेड विथ डायबिटीज और फिर हाइपरटेंशन में। तो ये दे लीड टू द टारगेट ऑर्गन डैमेज, एंड व्हेन स्पेसिफिकली रक्त इज विशिएटेड मोर, तो ये पक्षाघात में ये एंड अप होता है। वृद्ध वायु गेट्स एफ्लिक्टेड बाय रजस एंड पित्त, प्रोड्यूसेस मार्गावरण और रक्त मार्गावरण, वात मार्ग का अवरोध या फिर रक्त मार्ग का अवरोध, उसके कारण पक्षाघात को ये मैनिफेस्ट करता है। तो उन्हीं को जो है वो हाईलाइट करने के लिए मैंने ये दो श्लोक जो है, जो अंडरस्टैंडिंग मैंने हाइपोथेसिस रखा, उनके बेसिस यहाँ पर मैं आपके सामने रख रहा हूँ। यदा तो रक्तवाहिनी रस संज्ञ वाहानी च पृथक पृथक समस्ता व स्रोतांसी कुपितो मलाह, और ये करते हैं मद मूर्छा संन्यास तेषां विद्यात् विचक्षणः दुर्बलः दुर्बलम चेतस स्थानम यदा वायु प्रपत्यते। तो यहाँ पर भी जो है ये कार्डियक और सेरिब्रल एक्सेस की जो है ये बात मनीषियों ने की है, चरक ने की है कि देयर इज अ क्लोज रिलेशनशिप बिटवीन द चेतना स्थान एंड द वात स्थान। तो सेरिब्रल एक्सेस और कार्डियक एक्सेस इसका जो है वो कॉम्बिनेशन जो है दैट इज रिस्पॉन्सिबल, ये रस और रक्त के कॉम्बिनेशन से दुष्ट होकर के ये मद मूर्छा और या संन्यास को ये मैनिफेस्ट करते हैं। जब रक्त की दुष्टि, रस के दुष्टि के कारण रक्त की दुष्टि और रक्त की दुष्टि जब मनोवह स्रोतस, संज्ञावह स्रोतस और वातवह स्रोतस में संश्लेषित होकर के आवरण करके की या फिर धातुक्षय करके ये उत्पन्न करती है। अब कुछ एक बातें जो है जो यहाँ पर संज्ञावाह स्रोतस के बारे में रखी है, तो व्हाट मे बी द वे ऑफ एग्जामिनिंग। तो फर्स्ट ऑफ ऑल इज द अवस्थानम और विभ्रमीणम। हमें अवस्थान ओरिएंटेशन टू टाइम एंड प्लेस उसको जो है वो एग्जामिन करना पड़ेगा। दिस विल बी यूजफुल इन the cases of cerebral infarct. Then next one is Sankhya Nam Granena, that is also related with the Madhumurcha Sannyas consciousness level को check करने के लिए. Now the third one, the relationship between the psyche and the soma, असौमन्यस्य दुख जननानम। तो ये असौमन्यस्य है, ये वायु को और रज को डिस्टर्ब करके व्याधि को बढ़ाता है। तो ये कहीं ना कहीं साइकोसोमेटिक रिलेशनशिप को हाईलाइट करता है। दिस ओनली फॉर दैट वन आई हैव मेंशन्ड इन दिस स्लाइड। मूविंग ऑन टू द नेक्स्ट वन, द इम्पोर्टेंस ऑफ द शिरा। शिरा का दोनों जगह पर इंपॉर्टेंस है फॉर द मेंटेनेंस ऑफ द हेल्थ एंड द डिजीज। उचितैरपि हि च आहारस्य आदस्य वहन्ति न दोषोपलिप्त वदना रस रसवहा शिरा। This is from Ashtang Sangrah. Sorry, it is wrongly mentioned as Ashtang Brother. It is from Ashtang Sangrah, Sutra 5. The nutrition and the doshas travel through the rasavaha shira. The dosha uplipta shira leads to disease. When they are obliterated, they produce the disease. Now, how we would describe the disease? This is from the Aptopadesha mentioned in Charak Samhita। तीन प्रकार से व्याधि ज्ञान के उपाय में जो आप्तोपदेश में ये रखे चरक ने कहे हैं, उनको जो है मैंने यहाँ पर लिए। इनको मैं स्टडी यहाँ उसको पढ़ नहीं रहा हूँ, ऑगस्ट ऑडियंस है हमारे पास, तो ये सभी जो है वो जानते हैं। आई एम स्किपिंग दिस स्लाइड। दिस वंस अगेन द सेम थिंग, प्रकोपण, योनि, समुत्थान, आत्मनम, अधिष्ठान, वेदनम। तो इस प्रकार से हमें जो है वो प्रकृति प्रतिकार किस प्रकार से करेंगे, प्रवृत्ति करेंगे, निवृत्ति करेंगे, तो इस प्रकार से हम जो हमें जो है वो उसका डिस्क्रिप्शन करने की आवश्यकता है, ऐसा मेरा नम्र विचार है। दिस इज वंस अगेन द वायु अष्टांग संग्रह का है। जो कुछ एक जो है वो यहाँ पर अष्टांग संग्रह में वाग्भट ने जो विशेष बातें कही, उन्हीं को मैं जो है ये हाईलाइट करना चाहूंगा। व्यान का रोल हर एक फिजियोलॉजिकल फंक्शंस में है। हृदय अवस्थित कृष्ण देहचारी शीघ्र तर गति प्रसरणा, और उसके बाद विशोधन, स्वेद, अशुक, श्रवणादि क्रियो, योनो च शुक्र प्रतिपादनो, विभजे च अन्नस्य किट्टात् सार तेन क्रमशः धातु तर्पयति। तो ये धातु तर्पण की क्रिया में ये व्यान का जो है ये मैक्सिमम रोल है। जो आज की हमारी जो अंडरस्टैंडिंग है ब्लड सर्कुलेशन, पोर्टल सर्कुलेशन एंड देन आफ्टर द सिस्टमिक सर्कुलेशन, इसको जो है ये समझने में हमें और ये एट पार
टाइम हो रहा है।
सर मैं 1 मिनट में कंप्लीट कर रहा हूँ।
थैंक यू।
लास्ट पॉइंट ये अभी मैं हाईलाइट कर रहा हूँ, दैट इज अबाउट द चेंजेस इन द विस्कोसिटी ऑफ द ब्लड। This is from the Raktapit. So pramanam ativartate tasmin pramanati vritta pittam prakopitam shariras अनुसर्पद एव यकृत प्लीह प्रभवाणाम, ये तो ठीक है. नाउ द इम्पोर्टेंट वन, लोहित वाहनाम स्रोतसाम लोहिता विष्यन्ति गुरूनि मुखानि आसाद्यात् प्रतिरुन्ध्यात् तदेव लोहितम दूषयति. So there is the changes in the biochemical values of the blood, rasa, which is leading to the dushti of the rakta, and this accumulated portion of the rakta leads to changes in the pressure. This same, when the blood or the rasa is getting abhishandi, that will affect the vayu. वायु धातु क्षयात कोपो मार्गस्य आवरणेन च, ये दूषित रक्त है या फिर दूषित रक्त है जो अभिषंदिता है, ये वायु का मार्ग का आवरण करेगा और उसके कारण धातुओं में शोष की स्थिति जो है ये उत्पन्न करेगा. शिरा की ऑलरेडी मैंने बात कर दी है, इसलिए इसको मैं जो है वो डिस्क्राइब नहीं कर रहा हूँ. वर्कअप रिसर्च, designing tool for assessment of Raktabhishyanda, we don't have, we need to work out. Designing tool or test for understanding the functions of Udan Vayu and Vyan Vayu. Designing tool for testing of the Shira health. आज हमारे पास जो है वो इसकी कोई मीन नहीं है. हमारे पास कोई केमिकल एनालिसिस हो या फिर हमारे पास ऐसे कोई एक्सटर्नल नॉन इन्वेजिव डिवाइस हो जिससे हम आर्टेरियल हेल्थ को vascular health को हम assess कर सके. तो these are the need of the hour if you want to establish Ayurveda as a principal system at par system of the medicine. With these words, last one, the holistic Ayurveda care, the medicinal management, panchkarma, lifestyle changes, rasayan chikitsa, devyapashay or sattvaji chikitsa, lifestyle regimes. These are the way we can help in treating the patient, reducing the target organ damage. Thank you very much, sir, for giving me the chance to speak on this issue. आज मैंने विषयांतर किया है, इसके लिए मैं सबसे क्षमा प्रार्थी हूँ. थैंक यू वेरी मच.
क्षमा की बात नहीं है. देखिए, आज का दिन कंज्यूमर्स के लिए है, आज का दिन पेशेंट्स के लिए है, लेकिन आप लोगों ने बड़ा अच्छा पीएचडी स्कॉलर्स लेवल का एक स्टेटमेंट दिया, जबकि आज कंज्यूमर वेट कर रहा है कि हमें दवाइयां बताई जाएं. क्या दवाइयां हैं उनके लिए? मतलब सोसाइटी जुड़ेगी हम लोगों से तब जब सोसाइटी के काम की चीजें होंगी. तो बहुत बहुत आभार आपका. आपने बाकायदा शानदार प्रेजेंटेशन दिया. आप विद्वान हैं, ज्ञान का सागर हैं, मैं आपको नमन करता हूं. फिर भी अगले वक्तव्य से हम डायरेक्ट ट्रीटमेंट पे आएंगे और केवल ट्रीटमेंट पे बोलेंगे, ये मेरी प्रार्थना रहेगी. थैंक यू वेरी मच. नाउ आई वुड लाइक टू रिक्वेस्ट डॉक्टर अपर्णा सुरेंद्र. डॉक्टर अपर्णा जी, स्वागतम. डॉक्टर अपर्णा सुरेंद्र जी,
नमस्कार.
नमस्कार मैडम.
Namaskar. So today is World Hypertension Day. We all know two types of hypertension, essential or primary hypertension and secondary hypertension. Yogic intervention is applicable in management of primary hypertension. Hypertension is a major risk factor for coronary artery diseases, for example, heart attack. So hypertension is a risk factor. So it's becoming a primary cause of death in this era. The etiology for increased prevalence of primary hypertension is rapid urbanization in food and lifestyle. We call it as 5S: excessive serum fat, excessive serum salt, smoking, sedentary lifestyle, and stress. So these are called as 5S, which are the major modifiable risk factors. So the prevention and management of hypertension is nothing but lifestyle management. And we can boldly say, if you follow yogic way of lifestyle, definitely you can manage hypertension. So let us know what is this yogic way of lifestyle, and let us also know what are all the therapeutic yoga indicated in hypertension, especially primary hypertension. I would like to recall a shloka from Bhagavad Gita. Yuktahara viharasya, yukta cheshtasya karmasu, yukta sapnava bodhasya, yogo bhavati dukkhaha. Lord Krishna says, who is a yogi here? So he is a yogi whose food habits and lifestyle and actions are balanced and controlled well. So you have to modify food habits. Second one, lifestyle. Third one, actions, karmas. Okay. And he also calls him as a yogi who has divinity in his work. So you have to keep the God as a witness when you are doing your karmas. Then only we can do nishkama karma. So who has divinity in his work and purity in his mind, and who always wishes well for all. If you have love in your heart, definitely you will wish good for all. And whose sleep and awareness is meaningful. That means whenever we are aware, we should be some use to the society. So that is productive awareness. And when you go to the bed, you should have a sound sleep with all relaxation in your mind. See, the qualities of all these qualities of a yogi, you will attain when you follow a yogic way of lifestyle. And with this one shloka, we can say how to manage essential hypertension. So what is the yogic way of management of hypertension? So now let us move on to directly into the yoga management. So first I will give the list of indicated asanas in yoga. Then we will go one by one with their pictures. Okay. So coming to the standing asanas, Ardha Kati Chakrasana, second one Tadasana, third one Trikonasana. So these three are the standing postures, very well indicated in hypertension. I'd like to say which are contraindicated. Okay. So Surya Namaskara. So for a patient having hypertension, it's contraindicated. So if hypertension is only at the beginning stage, definitely we can teach Surya Namaskara. But a patient, known case of hypertension, we should not teach Surya Namaskara. So we have to teach him indicated asanas for maybe 3 to 6 months. And when the blood pressure gets stabilized and normalized, then we have to teach him Surya Namaskara. So only 3 standing asanas. After that, sitting asanas. In that series, 2 major asanas, Gomukhasana and Trikonasana. Of course, we can teach him Padmasana, Vajrasana, all sorts of meditative postures when we teach pranayama to a patient. And also, after Gomukhasana and Vakrasana, supine postures, Merudandasana, and Ekapada and Dvipada Pavanamuktasana. So prone postures are contraindicated if the patient's blood pressure is high. So Bhujangasana, Shalabhasana, and Dhanurasana, these 3 postures should not be taught to the patient initially till the blood pressure is stabilized. After 6 months of these indicated asanas practice, we can do some deviation from the standard protocol and we can teach him more and more asanas and Surya Namaskara also. After all these asanas, Shavasana for 5 minutes, followed by pranayama practice. Under pranayama, mainly 3 pranayamas. One is Nadi Shuddhi pranayama or Commonly, it is called as Anuloma Viloma Pranayama, and Bhramari Pranayama. And at the end, Dhyana practice. See, these are the standardized indicated yoga practice for hypertension. Now, let us know them one by one. What is the physiological effect and how it is helpful in controlling high blood pressure. So, under standing asanas, Ardhakati Chakrasana, you can see the slide here, picture. Chakra means wheel in Sanskrit. In the final pose, body looks like half wheel. It is also called as half wheel pose. I will not describe actually. For all postures, there is a method. So you have to, while going to the asana, you have to inhale. While bending to the lateral side, you have to exhale. And you have to, of course, you have to maintain the pose, because Patanjali says asana should not be done repeatedly. It should be done only once or twice, but it should be maintained with the breathing. So once you attain the pose, you have to become fixed in that pose for say 5 breaths or 10 breaths, maybe for 1 minute or 2 minutes. So here, that's why Patanjali says Thiram Sukham Asanam. So that is the difference between exercise and asanas doing. In exercise, we do it repeatedly. For example, Trikonasana, you do it as an exercise, bending and coming up, again bending to the another side. Repeatedly 10 to 15 times if you can do Trikonasana, but it is not the way here. When you do it as a yogic practice, you have to do it only once and stay in the pose for 1 minute or 2 minutes. You can take 10 breaths or 15 breaths in one pose. After taking normal breaths or deep breaths, then you have to exhale and come back. So this is the procedure. That's why then only we can call the asana as Sthira and Sukha. At the same time, it is fixed. It should be comfortable for you also. The perfection in the asana can be marked by your maintenance. How long you can maintain the pose. So what is the benefit of this asana? This asana stretches the thoracic muscles because you will be stretching your hand and bending to the sides. You stretch the thoracic muscles, improving the stamina of the thoracic organs, mainly heart and lungs. Okay. Now we will move on to Tadasana. Very simple posture, Tadasana. Tada means mountain in Sanskrit. Body becomes balanced and strong like a mountain by this pose. Just as mountain stands still and stable, one will be standing with the stretching their heels and stretching their hands. Because of the stretching in the feet, there will be more and more venous return. And because of the stretching of the hands, there will be more and more blood circulation, oxygen supply to the coronary, through the coronary arteries to the heart muscles. So due to the maximum stretching of the whole body, this asana enhances peripheral circulation also. Because of the peripheral circulation enhancement, there will be reduction in the workload of the heart. More than 25% of the workload on the heart is reduced by this simple Tadasana. So stand in Tadasana, say for 2 to 3 minutes, maybe 15 to 20 breaths, because it is very easy to attain Tadasana. Third one is Trikonasana. Trikona means triangle in Sanskrit. Body forms a triangle, enabling the balancing and stamina to the spine. So you will be balancing, and the spine also gets the strength because of this asana. Because the heart is supplied with the autonomous nervous system, sympathetic and parasympathetic. This asana is very helpful as it strengthens your spinal cord. So you have to maintain this asana maybe for 1 or 2 minutes. So it can be done repeatedly, like left side once and right side once. In each side, 15 breaths. Now coming to, usually people tend to hold the breath when they attain a pose. For example, now you are able to see the Gomukhasana in the slide. So once we attain Gomukhasana, we tend to hold the breath and do Kumbhaka. But Patanjali says Kumbhaka should not be done in the final pose. In the final pose, as few muscles get contracted and few muscles get stretched up, you need to get more and more oxygenation to the muscles. That's why you need to take breaths in the final pose. So once you attain the final pose, we have to train the patients. So we can give the counting in the yoga class. Say till I count to 20, they should breathe normally and pose. This should be the instructions given by the yoga teacher. So now coming to Gomukhasana, Go means cow, Mukha means face. Because this asana resembles cow's face, it is called as Gomukhasana. In this asana, it stretches the largest muscle, that is latissimus dorsi of the upper body, indirectly influencing the oxygenation and energization of the thoracic organs, especially heart. So because we are stretching the latissimus dorsi muscle, there will be removal of the venal congestion also from the inner organs. So Gomukhasana, this is the sitting pose. Now we will move on to Vakrasana. See, Vakrasana is done in all such places where Ardhamasendrasana is indicated, but the patient feels difficulty to attain Ardhamasendrasana. Ardhamasendrasana is bit more complicated way of doing Vakrasana. So Vakrasana is comparatively to Ardhamasendrasana, Vakrasana is more simpler. That's why Vakrasana is selected here for hypertension patients. So any asana which you can done easily without any jerks, with the little efforts, it is indicated in hypertension. So Vakra means not straight in Sanskrit. So this asana gives a maximum stretching to the diaphragm. So this is very, very important because you will be twisting to the sides, both sides, lateral sides. So the diaphragm is stretched here and abdomen muscles also are stretched here, removing the visceral congestion. So supplying of the fresh blood is very, very essential to all organs, whether it is abdominal organs or thoracic organs. So here, whenever we do asanas, especially like Vakrasana, Gomukhasana, because of the stretching of the diaphragm, because of the stretching of the abdomen also, there will be visceral congestion will be removed and there will be fresh blood supply to the organs. So these are sitting asanas. So finally, we are coming to supine postures. Merudandasana. In Sanskrit, Merudanda means spine. This asana, by twisting the spine, enables its alignment and balance. So spinal alignment is very, very essential. Balance is also very essential. So already I have told you. So to culture the autonomous nervous system, this asana helps and it improves the stamina of the cardiac muscles. So we have to repeat both sides. Left leg is kept on the right knee and then it is twisted towards the right. Then again, we have to tell the patient to come back, exhale and come back and release the left leg, and the same posture can be repeated on the other side also. Last posture in supine series, Ekapada Pavana Muktasana. Also, it is not like I have not mentioned here Dvipada Pavana Muktasana, but still with the little precautions we can teach them Dvipada Pavana Muktasana also. Pavana means wind or Vayu, Mukta means release. This asana removes the excess gas, Vata, from the stomach, aiding proper digestion. Sarve Rogaha, Malavashaha. We all know very well. So it removes, it induces proper digestion and it expels the toxins in the form of mala. So it relieves the constipation also. That's why this asana is very, very essential in hypertension. So before we go to Shavasana, which are highly contraindicated hypertension, all topsy-turvy postures, which all postures you attain a reverse pose, you go against the gravity, they are called as topsy-turvy pose. Such asanas are contraindicated. So mainly Shirshasana should not be done in hypertension. Sarvangasana and Halasana is also contraindicated. So for a hypertensive patient, remember Shirshasana, Sarvangasana, Halasana, these three asanas are, and Jatara Parivartanasana. In Jatara Parivartanasana also we will be lifting our both legs against the gravity. So we have to be very careful, because once when we lift both the limbs, there will be gushing of the blood, venous blood to the heart. There will be more increased venous return to the heart. So heart will be under some stress and burden because of the topsy-turvy postures. So we have to avoid both the topsy-turvy postures and strenuous exercises with all jerks and with more strength, like Surya Namaskara also we have to avoid. Now coming to Shavasana, you are seeing Shava. So when Shava means corpse, we all know very well, dead body, lying down like a dead body by having inner vision through deep breathing aids in removing fatigue and attachment, induces repose of the mind. So for stress management, this is very, very essential. During Shavasana, we tell them to focus on their breath or focus on their heart. So one thing, it removes the fatigue, and second thing, it removes the attachment. So Shava means this body is not mine. So I should give utter care to this body, and then I have to forget about it. Then I have to focus on the spirit inside. So this should be the lesson during Shavasana. So in this asana, there will not be any response for external or internal stimulation. So anyone enters the classroom, or if any disturbance is there, we have to tell them not to focus on all those disturbances. Mind is focused on one's own breathing, and then it is calmed down. All thoughts are washed away from the mind. So we have to remove all the negative thoughts and worries in this pose. And mind enjoys the nothingness, shunyata bhava. We have to remember that I am not this body, I am not this mind, I am not this sense organs, I am the pure spirit inside. I am not attached to any worldly things. So outer happenings are not disturbing me. I am enjoying my own real self. I am in the state of bliss. So when the mind becomes empty, then person purifies his mind from restlessness and negative thoughts. And this obviously Shavasana reduces the blood pressure. Pranayama. Prana means energy. Ayama means control. Breath is we all know very well, whenever we say prana inside the body, breath is the outermost manifestation of prana. If the breathing is there, prana is there. If the energy is in subtler form, breath is in the grosser form. According to yoga, if breath is irregular and allowed to wander, chale vate, chale chittam, nischale nischalam bhavet, yogi sthanutvam apnoti, tato vayum nirodhayet. That means if breath is irregular and allowed to wander, mind also becomes unsteady. Mind becomes chanchala. When breath is still and controlled, mind gets stabilized and relaxed. So this may be the result of parasympathetic stimulation induced by pranayama. For all pranayama, patients can attain any meditative postures like Padmasana, Swastikasana, Vajrasana or Siddhasana. Then they have to follow the following pranayamas. The best pranayama is Nadi Shuddhi pranayama. Attaining Chin Mudra, one has to sit in meditative pose and do Anuloma Viloma or Nadi Shuddhi for 5 rounds. So the method of Nadi Shuddhi pranayama is, the right nostril should be closed first. Inhale from the left, exhale from the right, and do the reverse. Inhale from the right, exhale from the left. So this is 1 round of Nadi Shuddhi pranayama. When it is done repeatedly, it balances the Ida and Pingala Nadi, and there will be, the energy will be directed towards the Sushumna, and which stimulates the awakening of the Kundalini. It is the purpose of Hatha Yoga, very purpose of Hatha Yoga. So Ida means left and Pingala means right Nadi. So Surya and Chandra Nadi. So right nostril breathing stimulates the left hemisphere of the brain. So left hemisphere of the brain is intellectual. Left hemisphere of the brain is intellectual, calculative, and analytical. It exercises one's intelligent quotient and boosts it up. Whereas left nostril breathing, so when you do Nadi Shuddhi pranayama, both nostril breathing are stimulated. So left nostril breathing stimulates the right hemisphere of the brain. The function of the right hemisphere of the brain is emotional, artistic, and creative. So it exercises one's emotional quotient and boosts it up. So because of doing Nadi Shuddhi pranayama, both hemisphere of brain's functions are balanced and controlled, normalized. Even physiologically also, there will be dominance of either left or the right nostrils, and for few hours. And this domination in the quantity of the airflow gets interchanged. This goes on like a cycle. For the balance of airflow and equipoise of the mind, this unequal flow of the air in each nostril must be stabilized. So how to stabilize? By doing Nadi Shuddhi pranayama, we can stabilize the airflow in both the nostril and take the energy to the Sushumna Nadi, where there will be awakening of the Kundalini or Siddhi of yoga will be awaiting for us. Okay. So now we will move on to the next pranayama, that is Ujjayi. Ujjayi pranayama is also called as Soham pranayama. Ud means pronounce loudly. Jayi means victory. So by doing this pranayama, one attains spiritual strength. But because you do here Ujjayi pranayama by partially closure of your windpipe through epiglottis, there will be sa sound when you inhale and hum resonant sound when you exhale. So that's why this is called as Soham pranayama. So it induces self-realization. So that is Om Tat Sat. We know the meaning of this shloka is that is me. Because of this pranayama, Soham means that is me. It indicates nothing but self-realization. This helps in spiritual inclination, making the patients to be aware of their own inner self, which has unbound hidden potentialities. So the stress reduces a lot when we do Ujjayi pranayama. So Ujjayi pranayama is heart-friendly. So we call Ujjayi pranayama heart-friendly pranayama. And the next we will move on to Brahmari pranayama. Brahmara means bee. This pranayama produces nada of a female bee, enabling the practitioner supreme happiness. So because this pranayama induces bliss and reduces the stress, it is highly indicated in hypertension. And after this pranayama, we will move on to the dhyana. Of course, in dharana, so when you are doing effortful dhyana, it is called as dharana. Mind is focused from chanchalata to ekagrata. So concentration. You will be keeping one object for your concentration, either Omkara chart or idol of the god. Then furthermore, it proceeds towards dharana, concentration 2. Dharana means focus the mind on a single thought. So from multiple thoughts, we will be in dharana, concentration 1, moving to single thought. And then in concentration 2, we from single thought, from multiple thoughts, again we will be moving to the single thought. So both in dharana, there will be dharana 1 and dharana 2, concentration 2, there will be single subject in dharana, there will be single thought in ekagrata, concentration 2, that is called as dhyana. So single subject with multiple thoughts in first half, that is dharana, and single subject and single thought in dhyana. So this is the difference between dhyana and dharana. For example, if you are keeping a Shivalinga and meditating on it, in the first half dharana, in the effortful meditation, you will be thinking multiple ideas about Lord Shiva. You will be repeating Om Namah Shivaya, but the thoughts will be multiple. You will be thinking about Ganga in his jata. You will be thinking about Trishula. You will be thinking about the three-eyed Lord Shiva, his Karunya, everything. That is dharana. Whereas in dhyana, you will be thinking about the whole form as one. Lord Shiva.
Madam, please complete by 2 minutes.
Okay, sir.
Thank you.
This unbroken flow of thought toward the object of concentration is dhyana. It is synonym to Tailadhara. Dhyana is nothing but like Tailadhara, flow of thoughts on a single subject uninterruptedly. That's why it is called as Hridayaste Ravi Prakya Trikonantara Deepika. It comes in Lalita Sahasranama. Antarmukha Samaradhya Bahirmukha Sudullabha. So you have to do introspection to remove the stress. When you do this introspection, japa, dhyana, prayer, meditation, there will be removal of the negative thoughts and mind becomes purified and the stress also reduces. There will be more and more stimulation of the parasympathetic nerves. So these are the yogic management of hypertension through yogasanas, pranayama, and of course dhyana. And also shavasana is also included here. Along with shavasana, sometimes highly personalized and customized yoga, we can even teach the patient yoga nidra to reduce the stress level. So because of all these practices, there will be blissfulness, expansiveness, and unlimited potentialities. And there will be, you will attain abode of knowledge, greater creativity, truthfulness, and purity and righteousness. So in one single line to say, yogic management of hypertension is nothing but modification of the lifestyle, following the yogic way of lifestyle. So to say in multiple slogans, it can be called as Sattvic Ahara in your diet, that is less salt, and of course Sattvic diet, which is named in Bhagavad Gita as Snigdha and Madhura Ahara, to strengthen your heart, and lifestyle, stress-free lifestyle, love and devotion in your heart, Sattvic diet in your plate, knowledge in your brain, prayer in your throat, Nishkama karma in your limbs, sleep and relaxation in your mind, sweet words in your speech, 1 hour exercise in your body. That is the yogic way of lifestyle. Thank you very much. If you have any queries, you can raise the questions in the end. And I thank once again for giving me this opportunity on this special day of World Hypertension Day. Thank you very much, sir.
Thank you. Thank you. You have explained practical remedies from yoga. Really great. Great, madam. Agnihotri sir, your conclusion. Then
Thank
I
you.
welcome Dr. Bhupendra Mani Tripathi and I welcome Dr. Mrinal Akre. Both are our speakers for next webinar on walnut.
Thank you, sir. Thank you, Professor Pawan Sharma ji. So in this way, we reached to the end of our first webinar, though we are running with the short of time, and all the three presenters and distinguished guest speakers of today really justified their knowledge, their experience, and their approach towards the management and defining the hypertension as well as its etiology. Well, our Raji told about the Unani aspect of the disease itself, and also talked about the history of the disease.